Today we're really excited to welcome everyone and thank you for your support of sustainability efforts on campus. Today's session is being recorded and being added to the library's repository of climate changes health and health equity videos. And so for those unable to come today, we welcome them to watch it there. In today's event, we'll be hearing from two groups. One is the co-chairs of the UHealth Green Team, who will discuss the hospital and clinical operations using the Practice Green Health Guidelines assessment as a point of reference. And then we'll hear from members of the Sustainability in Medicine Interest Group, who will present on how the U measures up against the Planetary Health Reportcard, which is a report that examines how adequately medical school curriculums address the intersections between climate and health. There will be time at the end of both sessions or both presentations to ask some questions. So I leave it now to.
Also, Mike is yeah. Is there a way to make the thing on the? Oh, you're doing it. You've got it. Okay, perfect. Well, hi. I think I've met actually most of you who are here. I am Alexis Lee. I'm the Director of Environmental and Social Sustainability for UHealth. This is my lovely counterpart.
Nice to meet all of you. I'm Smitha Warrior. I am the medical component of this team, medical director. So we have maybe seen some of you before at other presentations because this is one of those preaching to the choir crowds, right? If you showed up, you're probably already interested. And we've been on a roadshow now for almost 2 years of some of this information to introduce our work to the health system. So if you've seen some of this before, we apologize, but we also wanted to make it a broad introduction to allow for those that maybe are watching or watching later on video. Thanks, Brandon, for that option. That we can kind of get oriented to the conversation. So yeah, we're going to talk about pursuing green health and working on hospital operations. So this is where we really show ourselves. We're learning. It's the down. Okay, so just really again zoomed out for me as a physician that went through medical training, and granted I'm in the ORs, but you know, I had never in any of my educational career learned about or even remotely had thought about the link between the environment and the work I do in the hospital. I mean, the health you could kind of like, yeah, but how that related to me and the work at the hospital was never anything that I thought about or had learned about. But we know our health is impacted by the environment. Climate change is significantly affecting public health. And you know, as we talk about social determinants of health and marginalized and vulnerable patients, we know that these effects are not happening equally across our communities or our patient populations. This wheel on the right is you guys again might have seen, but it's from the CDC, and it's really just kind of an infographic. Hi, Cursa, to talk about all the ways in which changing climate in general can affect health, but especially a changing climate. So we see rising temperatures, as we are now seeing, right? We're seeing the severe weather as a result of that. One of the most common things that you see with heat in general, much less severe heat, is increase in traumas. So people are outside more. They're doing things they don't normally do to either cool off. So they're drowning more. They're getting in accidents more because they're just trying to be out of their homes, especially for people that don't have AC. But then there's, of course, severe weather. So you're seeing hurricane impacts, obviously flash flooding impacts. Also, there's a whole list of these things that follow. We're very familiar with air pollution here and the impacts on that, but there's a lot more press coming now, especially since New York is being affected, about asthma rates, right, from the Canadian wildfire, and seeing the asthma rates and ED visits going up. All of these things are things that have really clear links between changing climate and health. And then the next part that I learned about in my journey through sustainability in healthcare was like, what is our contribution? So once you put that together, you're like, well, what can I do, or how am I contributing? And healthcare is a significant portion of our greenhouse gas emissions in the world. And then no surprise that the US healthcare system is a significant and disproportionately significant piece of that greenhouse gas emission across the world. Our campus itself, and this assessment, correct me if I'm wrong, is not fully complete, but UHealth is about 30% of our overall campus's footprint in terms of emissions. And it all seems daunting. I mean, you go into the spaces I work in the operating room, and it's it's by far the most resource consumptive place of the hospital, and there's waste everywhere. There's single-use devices everywhere. It's a lot to process when you're in that space. And when you're thinking about it, and I always say, once you see this, you can't unsee it, right? And so once you see it, it's almost overwhelming to figure out, where do I even start? And so part of how all this got started is, what can each of us do? So if you recognize the problem, then we can also be part of the solution and start figuring out what to do. So one of the many ways that we got involved was, and we have our wonderful representative here, but Practice Green Health was a consulting organization that helps healthcare systems figure out how to do this. And they were our kind of first mentors and leading us into this work. And so as we developed our priorities with them, we really wanted to focus on clinical care and figuring out how to educate and practice environmentally sound care. We also wanted our systems to be resilient and our communities to be resilient. So we want our physical facilities to be able to withstand some of these extreme temperature issues, or be able to receive people when they're experiencing these issues outside. And we want to be able to educate our communities on how they can help themselves and take care of themselves during these situations. And then, of course, educating our future generations of healthcare workers and system, as well as working on research to advance this work. We had, again, through really great support and advice, we figured out how to kind of get formal roles in the institution. Our green team, Carissa was on there from the beginning, and Robert was a ragtag group of us that just kind of got together because we cared, much like how many things maybe get started. And then over the years, we were able to formalize the space, the roles, and really get system support. And the most significant way that we got support was really having people support this work being spread and getting it into each of the teams in the hospital, each of the departments. And then we were, again, lucky enough to be on our, asked to be part of Directed Steps, which is, for many of you, our strategy kind of for the institution. So we tried to incorporate those things you saw before into 2 steps. One is the 1U, and that's more an operational step, as you can see, is how we can actually work into the climate action change plan to do better. And then the served communities and regions tile was really to deepen this understanding of this work, the need for this work, and how to expand upon this work within our system and the people in our system itself. There's one more. We also had a community health needs assessment goal, which was really surrounding the resilience piece, and how do we get our community, including our facilities, geared up to better manage these situations. Alexis is going to go a little bit into the details surrounding what this means. Oh, here's our Practice Green Health shout out.
Yeah. So as Smitha was saying, we really got started in formal roles only 2 years ago, and our green team, the ragtag group, had started, I don't know, maybe
I mean that with love, by the way.
4 or 5 years, 4 or 5 years ago. So that group really evolved into formal roles with a lot of help from Practice Green Health. And Practice Green Health provides sort of a tool where hospitals across the country can keep track of sustainability data, and then they provide benchmark report cards so that we can see how our hospital and our health system is comparing against other hospitals, and especially against other academic medical centers. These are some of the data metrics. So when we talk about healthcare sustainability, I find that people often jump first to solar panels and recycling, and I like to say yes, and a lot of other things. So these are some of the many metrics that Practice Green Health helps us track. And you can see here that it's a lot. It's also what we buy. It's what we feed our patients. It's how we power our buildings. It's how efficiently we use that power. And so every year we collect all of this data. So far, we have started doing it for just our main hospital, but we're starting to expand now beyond just the main hospital into our 3 other hospitals and into our community clinics as well. But it's a big process. So what we do is we meet with our green team, and there are over 20 different teams across the health system that are represented there. So we have people from perioperative services, we have people from facilities, we have people from environmental services, nutrition care. We have a huge team of people, and essentially we work on completing the awards application, and we have very specific conversations that are relevant to each of those metrics. So you can see here those same metrics that I was talking about before, each of the different teams who have to contribute and give us information, and who we have to have conversations with, so we can understand the big picture of what's really happening across our entire health system. And then when we do that, we gather all this data, we send it into Practice Green Health, and then we hope. We hope that we'll win an award. And this year, for actually the third year in a row, we won a Partner for Change award and a new award, a Greening the OR award, which Smitha will talk about here in a minute. But so I want to highlight a few of the places where we're doing really well based off of our 2022 data, so the 2023 award. And the first is energy. So Robert Armstrong is our amazing energy and sustainability coordinator, and he has been working for many years now to help with a number of different kind of energy efficiency projects and other things. But so here are a few highlights. One is that the U actually gets a significant portion of our energy from renewable sources, and that amount of renewable energy puts us in the 86th percentile for academic medical centers. And we're actually slated to have even more energy coming online in the next year from a new solar field. So we expect that will actually even go up in our next year's application. But one of the exciting things is that our energy use intensity at our hospital is going down, and I'll show you that more in a minute. And what's even more exciting is that we have many ongoing energy efficiency projects, especially around our HVAC systems. I know that HVAC systems like kind of operate in the background, and you maybe don't think about them, but they have a huge impact on how much energy we use. And we're doing a lot in this next year to work on that. So here are some of the metrics that Practice Green Health has us track. And then here you can see how, and thankfully we now have 3 years of data. So you can start to see some trends of how things are going. And you can see that this most recent application in 2022, our energy use intensity, so that's essentially how much energy our hospital is using per square foot, is actually going down and is lower now than it was even 2 years ago. And so we're very excited. We are not yet, we're not yet below, we're not in the 90th percentile, but I have a feeling with the energy projects that are coming, we're going to be getting there. So that's one of our big highlights. And then the next one is food. And actually our Director of Nutrition Care Services is also here. So like our superstars are here. If you guys want to talk to them.
No coincidence either, right?
Yeah. So the last time that we gave this presentation, we talked about a couple of things that we had done to reduce food waste, which included Lean Path, which is a system that helps us kind of right size our ordering. And then we donate to the Feed You Food Pantry, which there's a location actually here in this building that's available for all of our students in our health sciences, as well as faculty and staff as well. So those were two things that we were already doing. And since the last time we gave this presentation 2 years ago, we have actually added a few things. So one is that we started sending our back of house food scraps to an anaerobic digester in North Salt Lake. And then the second is that we started partnering with a local group, Waste Less Solutions, and they've been picking up food from our cafeteria and taking it to the local homeless shelter, or the road home. So our nutrition care services team has really done a ton to drive down food waste at our hospital. The other thing is that we set a goal for 20% of our food purchasing to be considered sustainable using the benchmark that Practice Green Health provides with different third-party certifications. And we are up to almost 10% of our spending is considered sustainable, which is up from 7.3% the last time that Smitha and I gave this presentation. So you can see here that these are all of the food metrics that we're getting tracked on. So local food and beverage spend, sustainable food and beverage spend. And here is where you can see that we are making consistent and sustainable progress on increasing our sustainable food purchasing. So that is very exciting. And now I'm going to pass it over to Smitha to talk a little bit more about her space, the OR, where we won the Greening the OR award.
Yeah, that was a new one for us. And I was like, Julie, are you sure? You never know, but I think, small efforts yield big results sometimes. And to be honest, again, I think from where we were last time when we presented to this group, one of the biggest things is Alexis, we hired a sustainability product portfolio administrator. And so we have a person that lives on the supply chain team, but also reports to Alexis and our sustainability work, just surrounding having a lens on sustainability as we work with our supply chain on equipment and procurement of equipment, right? So we're on the front end of that process, not just the waste end. And that's been a huge boon to where I think we're going to see a lot of opportunity going forward. Part of this is right now we're at 10 out of 34 reusable products versus disposable, which, for the gunners in the room, right, that are looking for really good percentile score, it's like, this is still good. It's more work to be done. I did look at you guys when I said that. More work to be done, but this is an improvement, and it's definitely, compared to other institutions, we're doing well. The biggest thing and how I got involved in all this is a long time ago, learning the effect of inhaled anesthetics, the gases we put people to sleep with, and their effect on the environment. So in the Department of Anesthesia, we have done a significant reduction. We had actually done one before all of this, but there was creep back into the system at an academic training institution. We've grown a ton. We also get new providers all the time and new residents. And so keeping that learning curve was something we had an opportunity to do better on. So we did a couple various interventions like stickers on the machine, removing the offending agent in some cases, because there are multiple options of anesthetics you can use that are all safe. So we've actually did a really good job in reducing, and we hope to go that last mile in this next year of really working towards elimination. There is another piece to gases, which is nitrous oxide specifically, which we're working on right now to investigate. This actually becomes a larger issue, is because what we're finding out across the country is that nitrous oxide, most of it isn't actually being used on patients. It's being breathed in by us that are working in the hospital through leaks in the system, which is not ideal for a variety of reasons. So we are working to identify leaks, or at least quantify those leaks, and then cap our central system to minimize that. But it's significant environmental impact as well. The metrics that Practice Green Health talks about is things like our OR kits being reviewed. And this is internal work. So we have benchmarks with Practice Green Health, and I think we have internal work that we can continue to do better on. This is one of those things where we do 100% of our kits get reviewed annually to make sure that we are not being wasteful. In a separate role I have, we're working to really refine that process even more so that the stuff on the field is really curated and we're only picking out what we need. But we also are working again on single-use devices, minimizing reusables, and then HVAC applies very much for the operating rooms. Maximizing reusables. Sorry, I might have said that backwards. Thank God she's here. Here are our metrics, again, where we're showing improvement year over year. And really, again, there's always more work to be done, right? When they don't need us in this roles or anyone sitting here like one day.
When we work ourselves out of a job.
When we work ourselves out of a job, that'll be a good thing. But I have a feeling this will be ongoing work for a while. And that's really touting our own horn, right? Because we do want everyone to know how hard the system is working and supporting this work. But I think there's a long way to go. I think there's a lot more to do, as we alluded to. HVAC optimization. We're really looking at chemicals used in our facilities, in our stuff, like in our masks for the OR, right? There's chemicals that you're literally just breathing in the whole time through your case. Chemicals of concern that we all interact with when we're cleaning. And then, of course, waste. A waste audit would be a huge boon to us to help us understand our waste streams better.
Yeah, and I will actually add to that. So we're really excited because we're about to go out with a request for proposals for a new waste hauler that will get all of our hospitals and all of our clinics on the same contract, because right now they're not all on the same contract. And so when we ideally we'll have somebody in place at the beginning of 2024. And so this is a huge opportunity for us to start kind of revamping and increasing the amount of waste segregation and recycling that we do once we get this new hauler in place. So that is a really exciting, like, hopefully in our 2024 data, our waste numbers are going to look much better than they do right now. You'll notice it wasn't one of our spotlights.
Well, and it's hard because as much as work is being done, like Alexis mentioned earlier, one of the first people things see is, why is there no solar in the building? And there's good reasons on every building. There's good reasons for that. We have farms which are more effective and cost efficient. But there's also like, why don't we recycle in all of our spaces? You have people packing their stuff home or just every time they throw it away. So even though it may not be the most impactful on some of these things that really decrease our emissions or our footprint, it is very visible and it engages our teams and our people to feel like we're doing it. So it's totally important. And so that's something we hope to work on. Chris has worked hard on a room service model. To where, very much like the Huntsman and for our whole system, to where you can order food when you want it, when you need it. Especially in my world, we're taking patients to the OR whenever we want. We don't care when their dinner time is because they're not eating. But then when they get back there, there's, they've missed their window and we're wasting food based on a lot of this. So working towards if I said any of that wrong, Carissa, please. Room service model, nitrous oxide we mentioned, and really cool, and we're going to have to really use our green team differently, hopefully going forward, is that Alexis has worked really hard on a dashboard so that we can get our
decision support is working on a dashboard.
Alexis is driving decision support. So instead of spending a lot of time with our teams, which are really who's doing this work, to be clear. So our teams that are here represented and other ones listed are really doing all the work. But having to collect the data is not the work anyone wants to be doing. They want to do the work that creates the data. So having decision support create a dashboard to where it's automated really frees up all the minds and the work in the room, the people doing the work, to say, what could we do better? What are the problems we're still having? How can we push through those barriers, get innovative about creating solutions, partner together instead of like, figuring out the data. So that's something we're really excited about, to free people up to do other things. But yeah, I think that's our last slide.
That is.
But we have, what we didn't, sorry,
Yeah.
my bad. What we didn't show is we should have showed our slide with all the people, but we have a great team of people. And I think this sustainability is one of those things where you say it and people are like, yeah, of course. But like, how do you do it? How do you gather around it? How are you functional and how are we productive about it? We have some amazing people at this institution and more that we don't know about. So we really want to garner and harness like everybody to figure out, because we always say we're not the experts by any means. Well, she is more than I am by far, but connecting the dots for people, everyone can do something in their space. And so, we want to take away barriers and help support people, but there's so many spaces that we have no clue about. And so we would not know how to do it, but we need that input from everyone as to what can be done in their space. So if there's anything we can help with, any questions, advice, criticism, please reach out.
Yeah. Thank you. Hopefully we'll have some time for questions after our amazing School of Medicine team goes next.
All right. I'm taller, so I'm just gonna turn this up a little bit. Really happy everyone's here. Sorry, wrong keyboard. So we are members of the Sustainability and Medicine Club at the University of Utah School of Medicine, now called the Spencer Fox Eccles School of Medicine. And we every year do something called a Planetary Health Report Card. We've been doing this for 3 years now. This year will be our 4th year. We're planning on continuing this in the spring. Very similar to Practice Green Health. It is a metric scoring system which we use to kind of look at how efforts within the School of Medicine are affected by our broader institution, as well as how different aspects of medical school, which may be a little different than hospital operations, such as curriculum, impact our overall sustainability. And then we have many people involved. Most of us are represented here today. And then our faculty advisors are, of course, Dr. Warrior and Alexis. So I'll just provide a little bit of background, and then my colleagues here will go through different sections. But the Planetary Health Report Card was actually developed pretty recently. On their website, they consider it something called an institutional advocacy tool. So it was developed in 2019 at UCSF. Currently, it's expanded considerably, now involving 7 countries, over 75 medical schools. And it's expanded to other domains beyond just medicine. There's nursing, pharmacy, and physiotherapy. And it sounds like they're working on piloting like dental, OT, PT schools. So they're modifying this report card into something that can be utilized for many different academic curriculums. And the University of Utah, as I mentioned earlier, we've participated since the 2020, and we have so far published 3 report cards, which allows us to create a little bit of a trend and see how we're doing. So we use a couple abbreviations just kind of to let you guys know. PHRCs and stand for Planetary Health Report Card. SFESOM is our School of Medicine at the University of Utah. And then EHSL is the Health Sciences Library. So just as a broad overview, very similarly to Practice Green Health, the report card is scored via 5 metrics, which are all weighted slightly differently. The largest metric is going to be the planetary health curriculum and how that is incorporated into our curriculum at the medical school. And then there's interdisciplinary research in health and the environment, university support for student-led planetary health initiatives, community outreach and advocacy, environment and health, and then campus sustainability. And I'll allow each of my teammates to go ahead and talk about first planetary health.
All right, so the first metric is planetary health curriculum, and this is something we are especially interested in as the interest group because we want all of our classmates to learn about planetary health and the importance of it. So as you can see in the top corner there, this is 30% of the grade that we get on the report card, so it's pretty heavily weighted. There are some things that the university is doing quite well with this. Especially this elective sustainability medicine and health that we can take. It's taught by Dr. Lucy Hansen, and she's wonderful. It's a great class. Semester long, we talk about lots of different topics like extreme heat and weather events and their effect on health, food and water insecurity, and how climate change can affect food security for people, especially those of marginalized groups. We learn all about different regions of the world and how they're affected from climate change as well. And we have a few lectures on carbon footprint of the healthcare system, which we all really enjoy too, learning about waste and everything else that we just learned about. So that's a really fun class. Although not a lot of people in the school take that elective because it's optional. So we rely on the core curriculum to teach us all about planetary health, and it's actually quite lacking. There are 3 standalone lectures that touch these topics. So we have one lecture talking in our infectious disease course where it talks about vector-borne diseases and how malaria is spread and spreading more based off of global warming. There's a few slides on it. It's not a huge topic. We do have one lecture that completely talks about air pollution and how extreme heat can affect the cardiovascular system and pulmonary system. So that's a really fun lecture taught by Dr. Payne. And we have one lecture talked on the importance of plant-based diets and how that can improve our health there. But all of these other topics listed below are not taught in the core curriculum. So there are many opportunities to improve in curriculum. The first is that we want more planetary health curriculum in the core curriculum. So that would be our number one thing that we're trying to improve through metamorphosis, but it doesn't look like we're getting a lot of headway there, but we're trying. Next is we want more sustainability focused faculty integration. We have lots of faculty support for our interest group, but we aren't getting a lot of help for integrating into core curriculum and getting faculty support there, although we've had tons of help and support with it. And then lastly, we want more education on sustainable clinical practices. We get a little bit of this in the elective, but none at all in the core curriculum, which we would really like to see the rest of our classmates learn about the importance on how when they're practicing physicians, they can make better choices to make a healthier environment for their patients. So overall, we got a D+ for curriculum, which is a pretty poor grade, as you can see. So there's lots to improve on, which we're looking forward to. Hopefully, you can make some headway.
Right, and I apologize. I think I forgot to introduce everyone. I'm Ellenor. I'm a 4th-year medical student.
I'm Kenzie. I'm a 3rd year.
I'm Michelle. I'm also a 3rd year.
I'm Noah. I'm a 2nd year.
I'm Alexis. I'm a 3rd student.
And as for our next metric, this involves interdisciplinary research at the health sciences campus. And the weight that this had in for our final score on the Planetary Health Report Card was 17.5%. So just a bit less than our last one. But going into it, we have multiple independent faculty members on the health sciences campus that are involved in independent research projects. Some examples of them include atmospheric pollutants effects on pulmonary health, mental health effects with recreational activities, things like that. And we have many examples of independent researchers that are currently involved in projects such as these. However, we do not have a centralized place for all of these, and I'll get into that in just a moment. But going over more of our strengths, both at the Health Sciences Campus Library, which, remind me the name of that?
Eccles Health Sciences Library.
Eccles Health Sciences Library, as well as the main University of Utah campus, there are multiple research symposiums and seminar series being held to highlight climate health and sustainability research. Some of these include the Climate Changes Health and Health Equity series that's held at the library, I believe, right? And then the Global Change and Sustainability Center Symposium that's held on main campus. And I believe that's a yearly occurrence at our student union. So those are some of the strengths. We do have multiple examples of events where people can bring their sustainability related research on campus. But going into some of our areas that we need to improve, us here as both students and faculty members on the health sciences campus, we do not yet have a centralized place for all this research to be shown to us as healthcare professionals and us as healthcare students. So we really think that in the future, we'd like to have a place both for illuminating examples of research into planetary health and sustainability, and also through example like a symposium, as well as creating some sort of website or place where we can document and look out for future events pertaining to sustainability and health research. Our final grade that we were given for in regards to research initiatives was a B-, so a bit better, but of course we have areas to improve in that field as well.
Okay, so the next one is support for student-led initiatives. So this is a similar, for the same weight as the research. And again, we have a lot of strengths. So there's lots of support for student efforts, I think, generally, but we're working on improving this for sustainability. So students can apply for specific grants to fund these initiatives. And of course, the Green Team has been great, and they really value student representation. And then there's also lots of projects that students can get involved with. This is also a little bit tied to research, so there's definitely support for students to do research and then share those findings. So a lot of things that we're doing well. So some, I think, opportunities to really bolster this. We have a lot of energy from students and interest. So I think it's making it easier for students to get connected with these projects and resources. And so I think making it more clear about how to find these, so like better like advertising what's out there. And then something we also thought would be helpful would be to have a database of these resources, and as well as to find mentors, because there's lots of like faculty doing great work to just get students better connected. And so again, this was a B, so doing pretty well, but there's definitely room to improve.
The next metric that we'll talk about is community outreach and advocacy. And here it seems like the University of Utah institution itself is doing really well with some of these strengths listed here, but the School of Medicine itself is not included in a lot of those and is not making the efforts. So here the strengths include our student-driven initiative with our weekly newsletter. So every week there's a newsletter, and some sustainability facts and tips are sent out, and that was driven by the SIG here. And then the university hospital partners with community organizations. So the Utah Clean Air is a statewide partnership. It provides education and grants to allow individuals, businesses, and communities to improve Utah's air. And currently the School of Medicine is not involved in that. Utah Climate Action Network allows for public engagement in policies, and this is to aimed at reducing emissions and improving water resource management. In addition, as we've already alluded to, the Climate Changes Health and Health Equity series, it's really well and does really well in outreaching to the community as a community-read journal discussion. And so there's a lot of really good structure here, and that could be spread out to us as the medical school. So this was given a D, and you can see that there's a lot of opportunities for improvement that could pretty easily be reached. Unfortunately, we don't have any GME courses regarding sustainability and equity, and this is something that could be changed quickly and easily. I know we have the structure in place for that. And then as well, we have accessible patient education. A lot of these documents that are already existing just need to be somehow reached to the patients through MyChart or other accessible sources. And then again, we can strengthen our partnerships. We have the infrastructure through Root and True, which is our rural and underserved Utah training experience, and then tribal, rural, and underserved, urban and underserved medical education. So we have these structures within our School of Medicine that we can strengthen partnerships and sustainability efforts through those.
Okay, and I'll kind of finish off with campus sustainability. Like the other 3 sections before it, it's worth 17.5%. On-campus sustainability is kind of looks at more than just the University of Utah itself, the School of Medicine. And so the University of Utah does have a Global Change and Sustainability Center, as well as multiple courses that are under that umbrella. Of course, the U of U Green Team is also new and very active. And then a lot of the activities done by the Green Team, the efforts done by the Green Team are reflected in our report card. So our last metric that we got was that 71% of our resources come from 71% of our electricity comes from renewable sources, which we just saw is now even higher than that. And then we are currently building a new School of Medicine building. It will be LEED certified, as all new University of Utah buildings will be. And many of our members were present during a planning meeting to provide suggestions for sustainability, as we are the ones who will be in the building and be using the facilities. So opportunities for improvement here are very, very broad. There's a lot of them, and a lot of the activities done by the Green Team again are reflected here. But there could be a lot of School of Medicine focused changes that may make a greater impact as well. So the School of Medicine itself does not have a carbon neutrality plan for 2040. And then environmentally transportation. Transportation is kind of a difficult topic here at the U. Many of our faculty, students all drive, and there's not a lot of great options for things like tracks, bus lines. Those would be great systematic changes as well. Again, similar to the recycling, composting options, having School of Medicine specific guidelines about procurement, which, you know, they are instituted by the Green Team, but not here within our School of Medicine, specifically by our administration. And then efforts to kind of green labs within our School of Medicine, and then divestment from fossil fuel companies. The School of Medicine is currently still does have some investment in fossil fuel. So overall, campus sustainability is still considered a D+. I think the Green Team is doing a great job, but the School of Medicine itself does not have a lot of internal initiatives that we benefit from in terms of report card scoring. So overall, the School of Medicine at the University of Utah gets a C. We've participated in 3 years, so we have a couple trends. Initially, we've kind of been sitting in that C minus range, but we started off in 2021 with okay grades, dipped down a little in 2022. Part of that may be in part due to the fact that the report card has changed its metrics and changed the grading a little bit. And they're working on keeping that consistent so that it can be used as a longitudinal scoring tool. But overall, you can see all the sections are improved. The important thing to note is that many of these things are student driven by our interest group, by students, and also trickle down from the Green Team. And so we're kind of at, we're number 33 out of all of the 44 US schools that participate. The best school is Emory with an A, and then most schools kind of sit in that C+, C- range. So we're kind of average, which means there's a lot of room to improve. And there's a lot to learn from schools like Emory by reviewing their report cards. So in summary, also to look ahead, this year, the University of Utah, the Spencer Fox School of Medicine is instituting a new curriculum for the first year medical students. So at this moment, there are currently 2 different tracks of curriculum running. The curriculum that me and all these current students are on, and the first MS1s who we hope to bring on board with us. That means that there is a huge opportunity at this time to start bringing curriculum in, because they're rewriting the whole thing and instituting new faculty, thinking about specific changes that we can make to increase the amount of sustainability that's represented. And it kind of in conjunction with that, adding core courses, longitudinal pathways, instituting longitudinal education like we do with other clinical courses. And then, of course, student-led clinics are also being instituted now as more of a mandatory part of the curriculum, which have a lot of opportunity to look at sustainability changes that are also being done within the broader university. And then, of course, we will be doing the report card again this year. So if anyone is a medical student who's watching this, please reach out to us if you'd like to be involved. we're happy to open for questions. This QR code should link to the report card from this year if you're interested in seeing how we score and how we look at the metrics. So, but I would like to thank my whole team for coming. I know we're all very busy, as is everyone here. So. Yeah.
I know the report card is filled out by students.
Yes.
Only.
Yes.
Across all those 44 schools of medicine.
Yeah, so the report card is an entirely student-driven organization. They're actually applying to be a nonprofit this year, but all of the report cards are student-driven. All of the student leadership is student-driven. So everything, there's faculty advisors for the larger organization, but everything is student-driven and student-run with a lot of faculty support typically. Yeah.
Great job on the presentation. I was really intrigued by the Emory University and all those A's that they had, and just curious if there was something in place for you guys to exchange information with them. Are they pretty forthcoming, or like how could you increase that knowledge exchange with them, or what's in place?
Yeah, one of the difficult things about the report card is that much of it is very independently done within the school. And so a lot of communication between different schools is actually quite rare. I think the larger organization, the Planetary Health Report Card leadership group is planning on having multiple meetings where students can come and meet each other. And then of course, everyone who's involved in the report card is listed. And I think part of the reason why we publish the report card is so that other schools can see what we're doing differently and how we can learn from them. And so looking at Emory generally, like when you look at their report card, you see a lot of longitudinal curriculum changes, longitudinal stuff that's being implemented instead of just grassroots type movements.
Yeah, I'll add to that too. So right now we have been working with 3 entities. So Practice Green Health, who does our hospital operations stuff, ASHE, which is a part of the American Hospital Association, and then the AAMC, which is the American Association of Medical Colleges, to create a sustainability peer cohort group for academic medical centers. And so hopefully, because of the AAMC being involved, so they're essentially the entity that any medical school that's in the country has to be a part of the AAMC, and they I would say are like largely responsible for a lot of curricular shifts, and like I don't know if you guys would agree with that, but anyway, so I think having that group will hopefully open up opportunities for more conversation and collaboration between different schools of medicine, or specifically around sustainability and planetary health. The other thing that I will note is it's funny because I've talked to Emory about what they're working on, and it's interesting because I would say many schools have differences where like Emory is killing it on the curricular side, but in the operational side, like what we presented on, they don't really have any infrastructure for that. And they're not really doing anything in practice. And so, right, like whereas we clearly have a lot of room for improvement on our curricular side, but we are doing quite a lot on the operational side. And I would say that most academic medical centers throughout the country are somewhere in that spectrum, right? Where I would say I'm aware of very few where their curriculum is awesome and their operations are awesome. Yeah.
What would you say is like some of the barriers that are preventing like getting some of these curriculum courses, created? And then another part to that question is that I'm just wondering if it might be beneficial to have like a faculty advisor that's on the School of Medicine side. I don't know.
I think that, that's one of our suggestions, if you guys have other thoughts too, but it would be excellent if we had a faculty member that was specifically focused on sustainability, looking at the curriculum through that lens. We're all students, and so, I haven't had a lot of experience myself creating a curriculum. But one of the barriers was that our School of Medicine's curriculum has been around for decades, and it's changing as of this year. So I think we're at an inflection point where a lot of change and improvements could be made.
I'll add on to that too, because I know probably more about the new curriculum than most other people on the team do. There is a lot of room for growth, But at the same time, we're having some difficulties with presenting elective courses for medical students now with the new curriculum. In essence, students are starting clinicals sooner, and so they have less time to begin, or they have less time to devote to elective courses that we have the option of getting into. Like, for some examples include like global health as a pathway. You can take multiple courses in global health. But it's kind of, we haven't yet figured out, or at least I'm not aware currently, about how students can get involved in elective courses now. And it's kind of under question how those are going to work for our first year and forward students. That's the current situation with the curriculum side.
Yeah, I'll add to that too. So like we had some conversations with Ellenor and then a recent graduate, Anna Brandis, who has now just recently started her residency with Providence. And we talked with the med ed morphosis group that's going through the curriculum changes, and we're like, where are some places where we could put this in? And that is exactly one of the challenges, is that there's not a ton of elective, or the opportunities for electives is shifting with this new more hands-on clinical approach. But one of the places that we identified was in the pop health pathway. So we actually got a grant through the Global Change and Sustainability Center to pay Anna in her last year as a School of Medicine student. And she actually did write 4 curriculum modules that can be given in the pop health seminar series. And so we're working right now to hopefully get that incorporated in this next year. But it's like, it will, similar to what we have seen from this year's report card, it will be 1 lecture a year, and there's 4. And so like, over the course of a 4-year medical education, if you're in the pop health pathway, you'll get all 4 lectures, but it's still 1 lecture a year.
The only other thing, I have 3 things to add, bear with me here. So one, Robert, I think really great question. When we started and I was a faculty advisor, this was years ago, I can't even date now, back to Chris reached out because we were doing, this was the ragtag team when we were not formalized. And we were just trying to figure it all out. And the bandwidth of this has grown, to Alexis' point, to where, our focus was right now getting it in the structure and in the system, to try to work on operations for our neutrality goal. Education has definitely taken like a different place in that, especially because just me personally, honestly, I live in the operations world, and so I think we have a tremendous opportunity, to your point, to get a School of Medicine curriculum based, right? I'm School of Medicine, but I'm curriculum based kind of faculty advisor. The interesting thing is, like, Dr. Good's a huge supporter of this work, right? Like, he is super involved at the WMC level. Like, we're presenting there in November. He's asked us to present there. And then Sam Finlayson actually, before he just published a paper in the AAMC about. And then things like, so we have some disconnects I think we can work on, right? Because Sam is your new dean, and Sam was a huge advocate for how we even got started. So I think we have opportunities to help not only bridge that gap from our standpoint, but we can also help you guys get someone that's internally based, so to speak, to support you guys better. The other thing is that to your point on the clinical, so getting into curriculum is one thing. Anna did a great job. What I want to also start moving towards, to your point of longitudinal, is like, it's not that we have to create new coursework. It's that we incorporate it into every class we already have. So, right, if you talk about social determinants of health, one of the great ways I early heard on is like, you don't need to create a lecture for it. It's part of what we do. So you have to just bring that lens to every lecture we're getting. There's an ID component to this. There's every topic that you guys get taught on, I guarantee you there's a sustainability component that can be 1 slide even that gets put into a lecture, right? So that's number 1. But to your point of clinicals, we've been working a lot, not at your space, but at the departmental levels, to incorporate sustainability. Every department's in a different place with this clinically on the resident side, on the faculty side. And so we've been working with a lot of our departments to introduce it to them, or to expand, or give them an outlet of where to work. And again, I think because of me and my connections, it's mainly been perioperative because it's also been the biggest focus. But like, we have a great opportunity to expand into the other couple departments that we haven't hit yet. And then I think that was it. That was 3.
Yeah, there's a lot of research and papers out in like education focused journals about how different schools have incorporated sustainability into their curriculums. And one of the most effective ways is often just students creating slides they send to their professors and offering them to just stick it right at the end. And it's extremely effective, and it keeps it in mind. So But yeah, if anyone's a medical student, I would encourage you to just continue to talk about it during clinicals too. I tend to do a presentation every rotation on just how climate change affects health, and I think it keeps it in the back of people's minds. So.
I say unrelated, but to speak to that point, I work with pre-nursing, prevent, everything health professions lead here on campus, and I actually use the meme you made of the kitten crying with the
there are more kids over there,
right? I love them and they sit there, but I put that in there, and because it's presented as a meme and it just happens to be in one of my slides where I'm talking about health equity, you know, I don't even have to spend that much time about it. It's like, this is the thing, it relates to health, and all the students are like, meme, got it.
And
it comes through so quickly to like interweave it in that way.
And once you start seeing it,
yeah,
you just have that little switch.
That's it.
Yeah.
That's all it takes. But I do have a question for all of you. A lot of what we're talking about right now is like operations as well as curriculum. Is there anything that, and it was only briefly mentioned in some of those report cards, things like policy and procedure, stuff at the administrative level. Has there been any focus on that? Has there been an ability to even like get into those spaces to say, because it's like we don't, like the School of Medicine doesn't have a carbon neutral thing, and that comes from policy and administration. So like, how do we kick down that door?
Yeah, it's one of the, it's a very difficult section. We actually send out a petition usually every year. To all of the deans, we just cold email them with the petition. And I think it like keeps it on their minds, but like Dr. Warrior was saying, without faculty support or direct faculty involvement with our organization, it's often quite difficult to get involved with administration. If anyone has opinions about how to...
Well, I will add that technically the School of Medicine is included in the larger University of Utah carbon neutrality, right? So like,
yeah.
And you know, when we talk about carbon neutrality, what we're usually talking about is there's two levels of emissions. So there's the emissions that you generate on site. So like if you have boilers that are heating your building, and then the emissions from what you buy, like the electricity that you're purchasing off of the grid. And because that building is a part of our like larger overall campus scope, essentially it like the School of Medicine itself will get to carbon neutrality even if it doesn't have its own particular commitment. I will say that University of Utah Health also further took the Health and Human Services Climate Pledge, which has 3 pieces, one of which is carbon neutrality, and our timeline's actually a little bit more aggressive even than the Health and Human Services. So I will say that. The other thing is that the university as a whole has recently published, or well, not published, but we just finished creating a new climate change action plan, which essentially lays out all of the key actions that we need to take as a university to get to carbon neutrality between now and 2040. And right now it's in the like getting prettied up by the marketing team's phase, and it's about to go to the president of the university for his like formal approval. And if you go to his like vision board that's been published online, you'll see that the climate change action plan is one of the like one of the key sections that he has under like services to the state. So it, you know, it's possible that it will have a few edits as it goes through that approval process, but that plan does lay out a lot of steps, and many of the steps within that plan would apply to the School of Medicine, even if the School of Medicine hasn't like adopted it as its own entity. And I think so, like, on the one hand, I can see how that would be really beneficial. And on the other hand, I can also, it's like, there are some points where it's like, well, we also want to make sure that we're taking a whole campus approach, right? We also have 4 other schools and colleges, and we have a whole hospital that we have to, you know, and clinic system that we have to get to carbon neutrality, plus a whole campus. So sometimes I think working as with a 1U perspective on those really big things is like might actually get us to the end goal better than having like just one entity make its own plan.
Well, and a little bit more granularly, like in terms of, again, I think it disconnects the wrong word, but the way we're set up as an institution where hospitals and clinics runs its book of business and School of Medicine runs it, right? We have faculty and employees that both work in the same space. That's where I think the administrative lens gets different. And I think we have some restructuring of that now with our change in dean and things like that. But, you know, what we're trying to do clinically, for example, is, again, a little bit of a synergy of roles, working again from supply chain from the get-go, is that everything that's being brought in is looked at differently, and it's on the front end. And Alexis has done a ton of work, all of our new buildings, our new hospital, West Valley, like everything having a sustainability lens and building in. And this is where one of the nice parts of kind of the last 2 years is integrate with system support is being put into and having someone like Alexis at all these spaces so that in all the spaces that have never considered this work before, it's just coming to a bigger conversation. I think there's a lot more work to do, but I think to your point of like, you have to integrate it into where the decisions are being made, not afterwards. And so I think we're really starting to, that's really honestly been the last 18 months is getting into the spaces, getting to the table, figuring out, right? I think not all the decisions go our way, right? But like being at the table is a step, and then we'll continue to have these conversations to build into the front end of policy and decision making, hopefully.
Yeah, there's definitely there's a long way to go. So. Yeah, sorry, Julie.
I thought I saw your hand.
I may have, but
Okay,
it's
but I
long
talked too
since
much.
departed.
Yeah.
As I was listening to your thoughts and remarks, thank you. Great presentations.
Yeah, really great job. Yeah.
Anyways, we're open to any assistance or suggestions that you have, so please email any of us.